So let me start by welcoming you all, dear panelists and participants who are in Barcelona and who are connected with us from all over the globe. This is the first of two sessions organized by the WHO Regional Office for the Eastern Mediterranean at this round of the World Hospital Congress. My name is Awad Mataria. I'm the Director of Universal Health Coverage and Health Systems working at the WHO EMRO Regional Office. In this session, we will focus on some of the health systems reforms that have taken place in selected countries of our region over the past decade, and in particular, following a seminal paper that was endorsed by our regional committee and an associated resolution in the year 2012. As you know, colleagues, the Eastern Mediterranean region is a very diverse region. It has 22 member states, expanding from Morocco to Pakistan, with countries that have varied levels of income, but also different socioeconomic level of development and different political systems. Indeed, in our region, we count 6 high-income countries, 6 low-income countries, and 5 upper middle-income countries, and 5 lower middle-income countries. And we have many of the countries of the region, unfortunately, that are faced by different types of emergencies, either acute or chronic emergencies. The region has a population of around 635 million, and it hosts a very significant number of refugees, IDPs, and also migrants. We count almost 9% of the world population. However, our region spends less than 2% of what the world spends on health. So we are really a region that where many of the countries are low spenders on health and are not investing enough in health in general, in their health systems, but also in the hospital sector. In the 2012 paper, which I referred to, we tried to analyze the challenges that the different health systems in the 22 countries are faced with. We could identify the gaps that exist in these health systems, and accordingly, we could distill 7 regional priorities, which we recommended for our member states to work on in order to strengthen their health systems to move towards the goal of universal health coverage. The 7 priorities that we could identify then include strengthening leadership and governance, including that the one related to promoting health management, as related to the hospital sector, but also the health system at large. The second priority was related to reforming the health finance systems in the different countries of the region in order to enhance the goal of financial protection. The third priority was related to strengthening the health information system to be able to distill the lessons, but also the evidence to inform a reform process in the different health systems of the region. The fourth regional priority was about investing in health workforce, increasing the number, but also increasing their capacities and their competences. The fifth regional strategic priority was about improving access to quality essential health services. The sixth one was about engaging the private health sector in order to fulfill the national goals of health system strengthening, health system development. And last but not least, the seventh regional priority was about improving access to essential medicines and technologies. Today, we count almost a decade since the endorsement of that paper. A lot of hard work has been invested in informing, reforming, transforming the health systems of the region. However, there has also been many surprises in different countries of the region and many challenges that have emerged since then, including, unfortunately, the current pandemic that our countries of the region, but all the countries worldwide are living through. And this did not spare the hospital sector. So the hospital sector, as part of the overall health system, has been affected by these different challenges and has been trying to cope and to respond to them with different levels of success. In this session, we will be listening to different experiences from keynote speakers, from great experts coming from different countries of the region, who will be sharing with us some of the lessons that they have distilled from these different health system reforms as related to their countries. We hope that this session would set the scene for more in-depth discussion that we are looking forward to have next year in 2022, and when the World Hospital Congress take place and reconvene in Dubai in the United Arab Emirates. So we are pleased today to have with us 6 great speakers. I'm really thankful for all of them. The first one will be my dear colleague, Dr. Abdul Wahab Al-Madani, who is the Director of Planning and Financial Resources at the Ministry of Health of Morocco. The second panelist whom we have today is Dr. Tahir Hussein, who is the Chief of Strategy and Transformation at the Ministry of Health in the Kingdom of Saudi Arabia. The third panelist is Professor Alawi Al-Sheikh Ali, who is the Deputy Director General at Dubai Health Authority in the United Arab Emirates. The fourth panelist is Dr. Najibullah Safi, who is the Health System Coordinator at the WHO office in Afghanistan, in Kabul. And the fifth panelist is Dr. Ahmad Al-Subki, who is the Chairman of the General Authority of the Healthcare Provider Organization at the Ministry of Health and Population of Egypt. And last but not least, Dr. Kosum Al-Salmi, who is the Director General of the Royal Hospital at the Sultanate of Oman. So we really have great experts with us, with different backgrounds, with different responsibilities in their countries. What joined them is that they are all involved in different types of health system reforms in their countries. And we will be really pleased and honored to listen to their experiences, their reflection on what happened in their countries over the last 10 years. The way I'm proposing that we organize and hold this session, I will start by addressing one question, the same question, to our 6 panelists, and I will be giving each of them 5 minutes to react to that question. And in the second round, I will ask another question, and we'll see how the time will flow, but maybe they can answer that second question in 4 minutes each, and then we will have some questions and answers. So please do not hesitate to post your questions as we are going along with the session. So let me start first by Dr. Abdul Wahab Bin Madani from Morocco. And my question to you, Dr. Abdul Wahab, why were health reforms needed in the context of Morocco, in the health system in Morocco, and in particular in relation to the hospital sector? And what were the main strategic directions that Morocco has considered in order to reform the health system in the country over the last 10 years? Over to you, Abdul Wahab. Thank you very much.
Thank you. Thank you, Dr. Awad. Yes. Thank you very much. I have the pleasure to be with you, and I thank the organizers for the invitation to give you a brief about what we are doing in Morocco after COVID-19 pandemics, after facing pandemic of COVID-19. The health system in Morocco faced a lot of struggles, so we have lots of insufficiency in Morocco. We had lots of insufficiency, but the COVID-19 pandemic has led the governments to accelerate the reform of the health system and the reform of hospitals in particular. So we have had lots of problems like insufficiency of human resources, insufficiency of financing of the sector. We have 40% of the population which are not covered by the insurance, health insurance. So the pandemic and the lessons we have learned about the pandemic led the government to accelerate the health system reform to achieve the universal health coverage in next 2 years. To achieve this goal, we implementing a deep reform of the health system by reviewing its organization and the roles of different stakeholders. This project has a high political support because the king is implementing, has given his direction and instruction to implement this project of achieving universal health coverage in next 2 years. So we have the political supports now. All the sectors, all departments of the government are now work together to achieve this ambitious goal. So the achieving of universal health coverage, to achieve, we have to implement a real reform of our health system. We have driven lots of reforms by the past, but we didn't have the real impacts in the health sector. So now we are facing our organization, our actions to review the organization and to implement a new governance of the health system. So we are now reviewing the roles and the message of Ministry of Health. We will create a new high authority of regulation to separate missions of regulation and other message related to healthcare, especially. So we are now making this high authority, which is independent of the government, which regulates drugs, regulates insurance, and accreditate establishments of care, public and private. And after that, and with that, we are reviewing the structures of hospitals. The hospitals now in Morocco are fragmented. So we have different level of hospitals, and without a very real connection between them. So now we are aiming to implement hospitals groups, regional groups hospitals, to reorganize these hospitals and to have complementarity with different level of hospitals in each region, and it will with that we can have a good implementation and affectation of the human resources. The human resources will not be now established in only one hospital. They will dedicated to the group of hospitals, and this group of hospitals, they can give them their program, and with that we can face this insufficiency of human resources. With that, we are now opening the sector, the practice of healthcare for the foreign persons. Every doctors who wants to work in Morocco, they can work in Morocco. Foreign doctors can work now in Morocco. Investments, it's open to the investors, foreign investors too, investments in health. The parliament has approved this law since 2 months. Really, we are accelerating the reform, and the information system and the digitalization of the system of health is important, and we are implementing a new information system to drive and to monitor all the activity of health system. Thank you.
That is wonderful. Thank you very much, Dr. Madani, for sharing this important experience.
To drive and to monitor all the activity of health system
over the last 10 years, which is universal. That is wonderful. Thank you very much, Dr. Madani, for sharing this important experience.
To drive and to monitor all the activity of health system
over the last 10 years, which is universal. That is wonderful. Thank you very much, Dr. Madani, for sharing this important experience.
To drive and to monitor all the activity of health system
over the last 10 years, which is universal. That is wonderful. Thank you very much, Dr. Madani, for sharing this important experience.
To drive.
Healthcare reforms were needed in the context of the health system in Saudi Arabia, and in particular as related to the hospital sector, and what were the main strategic directions that the country has tried to address by the different reforms over the past 10 years. The floor is yours, Dr. Hussein. Thank you very much.
First of all, Dr. Awad, thank you so much. It's a privilege to join this very distinguished panel. And I can see colleagues from different countries with different sets of challenges, but there are a lot of commonalities as well as part of this cluster of countries. We have some similarity of challenges and similarity of pressing needs at the same time. So I'm privileged to be part of this discussion. Coming back to the question, why we needed reforms. I think before I really answer that question upfront, it's important to know that in this part of the world, the healthcare is a larger responsibility on the state rather than on the individual. So, because majority of the countries in this part of the world, they're heavily, driven by the social responsibility of the state. And the private sector is very minimal, or it's evolving, or it's growing. So a larger responsibility actually rests on the state. So that's the background. So state in the past, what has been doing out of commitment towards the citizens and towards the residents, they have been providing healthcare, but the healthcare has largely been treatment-driven, curative, rather than preemptive or preventive, or driven by the population needs. So the system was always responsive to the acute care needs of the population. So that's why the majority of the infrastructure was built around that need. That whenever somebody has a problem or somebody has an acute healthcare need, so they may go and they can get the treatment, or they get the cure. Lately, the transformation actually was further propagated by the vision set by the government here in Saudi Arabia, which is Vision 2030, and it's a very, very famous transformative vision, and it is actually impacting very positively across many different sectors. And luckily, healthcare has to be one of the first sectors which picked up and chosen to introduce reforms to. It was observed, apart from the imperatives which were set by Vision 2030 by the leadership, it was also observed that the healthcare costs are rising continuously for the last many decades rather, because it was acute care driven healthcare system. And then at the same time, another challenge which actually contributed significantly towards the disease burden, that was the unhealthy lifestyle. So, which has led to rise of the chronic diseases significantly in this part of the world, and of course, Saudi is no exemption. And the chronic diseases, as all of us we know, that this is one of the highest burden of costs as well on the state to manage the chronic diseases. So, chronic diseases have been growing, costs have been going up, and the systems were very acute care driven and hospital based system. Which means all of us, they contribute the very low economic value of the healthcare system. So, so these are some prompting factors which were considered, that despite all the costs going up for the factors which I just mentioned, and since it's a state responsibility, so the expectations of the patient are very high. So on one side, the economic value is not going up, and the output is compromised for the given let's say inefficiencies of this system, or let's say poor population health management, poor preventive efforts, and disease burdens are going up. And on the other side, the expectation of the patients are also going up correspondingly. So this paradox was one of the key factors which actually led to the fast track transformation program introduced in the Ministry of Health. And last but not the least is that, which everyone is facing, of course, the insufficient hard infrastructure. So as well as the soft infrastructure, which is the intellectual part of the system. So shortage of manpower, shortage of beds, and at the same time, shortage of the quality manpower system was facing. So all this put together, the government decided that healthcare should be put into a fast track for transformation. So what we're doing right now is that, again, as our distinguished colleague from Morocco, he just mentioned that we are looking at the system very holistically, and we are trying to transform the system from a cure driven to a value-based care, which is very heavily focused on the population health management. So in addition to that, there's a very decent split between the roles and responsibilities of the different stakeholders with very clear responsibilities now. The payer and the provider and the regulator, all three of them, they have been now very discrete responsibilities and very clearly defined roles. So in the light of this split of responsibilities, what we're doing is that we have created 21 geographic networks of hospitals and primary care centers, and of course, all in between. So every cluster is a set of tertiary care, is led by tertiary care as a pathfinder, and then around that there are sub-networks which are actually hub and spokes for the secondary care hospitals, and every secondary care hospital is fed by 30 to 35, 40 primary care centers. So that is the geographical setup which we are doing right now. Ultimately, the idea is that we create the value-based care where the patients are very happy, the quadruple aim. Patients are happy, staff is very happy, and then there is economic value for the healthcare delivery. It's efficient and it's effective care, and of course, with more preventive approach rather than curative approach. So that's what we are busy right now.
Thank you very much, and I'm sure you will be busy for some time with all these great reforms that the Kingdom of Saudi Arabia is embarking on. Thank you for emphasizing that the health sector reform was part of an overall national vision that has been stated for the whole kingdom, the whole country, and where health has been prioritized amongst the key sectors to start that transformation and that reform. But I very much also appreciated what you mentioned as some of the reasons why the health sector reform has been envisioned and embarked on in the Kingdom of Saudi Arabia, including the increasing cost of care, which became really a burden on the country, but also the change in the demographic transition and also the epidemiological transition with the increase in the chronic diseases, non-communicable diseases, which are the ones that are driving the cost big time. And the vision where you are moving towards, I mean, this value-based health system is something that one would very much like to learn from. A key feature, I think, from what you have discussed also, Dr. Hussein, is that separation of functions, separation of roles and responsibility in the health system. Today, indeed, we had a session in our office to discuss the response of the Kingdom of Saudi Arabia to the COVID pandemic. And one of the lessons that have been strongly emphasized that how that separation of roles and responsibilities has introduced a notion of accountability that might have contributed to a better response, beside the learning that the country has gained from the previous pandemic. Unfortunately, the one that I'm referring to is MERS in that case. So that is wonderful, and looking forward to know more about that experience of Saudi Arabia. But let me now move to another high-income country in the region, which is also embarking on many reform, and that is the United Arab Emirates. And I would like to address the same question to Professor Alawi Al-Sheikh Ali to share with us why health sector reforms have been embarked on in the Kingdom of in United Arab Emirates, in particular in the hospital sector, and what are the directions of the reforms that have taken place over the last decade. So the floor is yours, Professor Alawi.
Thank you, Dr. Awad, and it's a pleasure to be with you and with colleagues on this panel. The UAE, as you know, is a young country. We'll be celebrating the 50th anniversary of the formation of the federation in just a couple of weeks. And it's also a rapidly developing country that has seen very rapid transformation across various sectors over the past 50 years since the formation of the United Arab Emirates. I think that the question of why should there be, or why is there a transformation in the health sector, to the extent that health systems ideally should be learning systems, you could argue that they should not be a reason for health systems to reform or transform or evolve. That should be sort of part of the natural progress of health systems. But if we were to pick main triggers for the reforms in the health system in the UAE, I would say it's probably the rapid development that the country has gone through over the past 50 years. The UAE is a federation of 7 emirates, and health system regulation really is divided into 3 main regulators in the UAE. So for the Emirate of Abu Dhabi, there's the Department of Health that regulates facilities and providers in the Emirate of Abu Dhabi. For Dubai, it's the Dubai Health Authority that regulates, and then for the Northern Emirates is the Federal Ministry of Health and Prevention. So it's unique in that sense that you have a federal entity, but you also have local regulatory authorities that work in alignment and coordination with the federal authorities. If we were to identify the major changes that the system has gone through over the past decade, I would point out to probably three main changes. One was the introduction of mandatory health insurance, and that was done in a phased approach, initially in the Emirate of Abu Dhabi, and then later in Dubai, and more recently across the Northern Emirates. And it's in different phases of development, but mandatory health insurance, I think, for all citizens and residents of the UAE is something that is transformational in the health system. That was paralleled with, or maybe was essential for the second major change, and that is the rapid growth in the private sector in terms of healthcare provision. And again, that varies from emirate to emirate, but it's anywhere from a third to 2/3 of the health services currently in the country are being provided in the non-government, non-public private sector. Whether you look at the actual encounters, or you look at bed capacity, or you look at workforce, it's anywhere from a third to 2/3 private sector. And that was made really necessary by the rapid development and growth of the country. And it actually served, I think, the UAE very well during the pandemic, where the private sector played a significant role in partnership with the government sector in containing the COVID-19 pandemic. The third major change, I would say, is sort of separation of the regulatory function from the health provider function. That again started or was phased across the various emirates, initially in Abu Dhabi, and then again more recently in Dubai and the Northern Emirates. A unique feature of that separation is a more recent development in the Emirate of Dubai, where the publicly funded, either directly or indirectly, healthcare delivery assets, the hospitals, the primary healthcare clinics, and the specialty clinics within the current Dubai Health Authority structure were included in a new structure that was just announced signed into law a few months ago in Dubai, the Dubai Academic Health Corporation, where healthcare delivery is integrated with research and education by bringing in these government-funded healthcare provider assets with a University of Medicine and Health Sciences, the Mohammed bin Rashid University of Medicine and Health Sciences, to be the academic arm of the health system provision, and also a strong advancement function with the Al Jalila Foundation. The whole idea is, if we adopt an academic care model, you will improve quality of care, you will improve efficiencies, and you will improve access, and you will make the system a magnet for talent and for the life sciences industry. So that's a major transformation, really, in the way healthcare will be delivered in the Emirate of Dubai, where the academic care model will be the way care will be provided in the public sector, at least with integration of clinical care with education. And research. And I'll stop here, and then we can follow up, I think, in the
Yes, thank you very much, Professor Alawi. I think great lessons, great messages. You refer to the country as a nascent country, new country, but a lot has happened over the last few decades. A lot of developments in different sectors, including in the health sector and the hospital sector in particular. I like in particular what you refer to as learning system and learning health system. And we can qualify that as the same thing we can be related to the hospital sector, how the country has been learning as it was developing. And it is important that we distill the lessons from that learning exercise. And that's why I really appreciated your reference to academia and how both the health sector and the academic sector are working hand in hand in order to keep informing that reforming process, and wishing all the best to Dubai and to the United Arab Emirates as it moves further. Indeed, next in 2 weeks' time, or no, more than that. In 3 weeks' time, we'll be celebrating the Universal Health Coverage Day in Dubai as part of Dubai Expo. I mean, we are very much privileged to be partnering with the government in organizing these activities over there. So thank you very much again for this great intervention, Professor Alawi. So now I mentioned at the beginning that our region is a very diverse region, and it's a region where you don't get bored. Indeed, we have different countries, different backgrounds, different systems. So if you allow me now, we'll move to another country, which is a country that unfortunately has been shaken by many challenges, by many crises, including a recent political development that has taken place, and this is Afghanistan. And we are very pleased to have with us my colleague, Dr. Najiballah Safi, who is the health system advisor at the country office. Najiballah has been involved in several health system reforms in the country over the last, I may say, almost 15 years or so. So he knows exactly what is happening in the country. And I would like to address to him the same question. So in the context of Afghanistan, please, what were the major health care reforms that took place? Why those reforms have been identified? And what were the major strategic direction in that regard? And please, with a focus on the hospital sector, if you allow, Dr. Safi. The floor is yours. Thank you.
Thanks, Awad. It's a pleasure to be part of this panel under these challenging circumstances that we're facing these days. As you indicated, diversity, so diversity is there, and colleagues were talking about development of the system, but I may talk completely about different issues, which is more relevant to the context of Afghanistan. So, due to prolonged conflict, the health system was completely destroyed and it was not functioning at all. The basic infrastructure for health system at the primary, secondary, and tertiary level, this was almost non-existent. The coverage was quite low. Only 9% of the population had access to primary health care within 1 hour of walking distance. Definitely, the quality of the care at all levels was unsatisfactory and poor. Worse maternal health indicators were there. I can give you a few examples, like maternal mortality of 1,600 per 100,000 live birth, under 5 mortality of 257, and infant mortality of 161 per 1,000 live birth. These were the common indicators that we were facing. And in addition of that, shortage of healthcare providers, particularly in provinces and remote area, and then shortage of female healthcare providers across the country. These were the common problems that pushed the government and partners to introduce some reforms within the health system to address these problems. So what happened? The first thing, we developed the basic package of health services and the essential package of hospital services. These two packages define the scope of health services within the country, and they were focusing mainly on infectious disease control, maternal health, child health, nutrition, disability, and provision of essential medicine. And then the essential package of hospital services was providing backup support, referral support to the BPHS facilities. So first, we define the scope of services, and then these packages also define the structure, the equipment, the type of services which should be provided at each level of health facilities. So we had a standardized structure and package of services which should be available at each level. The second reform which was introduced, that was because government didn't have capacity. So all these services were contracted out in a large scale to national and international NGOs. And contracting out, it worked well because it rapidly expanded the coverage of services. The third major interventions which took place, that was the training of female healthcare providers. So we introduced 2 new cadres, community midwives and community nurses. All were female, and thousands of community midwives and nurses were trained in a 2 years program. And in addition of that, extensive training program was available for existing healthcare providers. So all these work well, and we proceed with, we had enough progress with maternal health, child health, and maternal mortality declined to something 600 plus per 100,000 live birth. Child mortality and the 5 mortality, it reduced to 50 per 1,000 live birth. So there was, and also the access increased to more than 90% of the population had access to health facilities within 1 hour walking distance. At the beginning of this year, 21, the country was on its way to expand the content of these packages and merge both the packages under one package, which was called Integrated Package of Health Services, or it was also called UHC Benefit Package. And it was planned to initiate the implementation of this new UHC Benefit Package from July 2021. But the recent political development put all the gains of duplicate at risk. So now we are struggling with sustaining what we have, the same BPHS and EPHS, and the discussion on the provision of the universal health benefit package that is almost ruled out, and further political development will guide us and tell us that how we will handle the existing situation. But the good news is that till date, we were able to maintain BPHS, EPHS, and there are expectations, though different donors, including World Bank, they post their funding to Afghanistan, but still we have some commitment, and the level of services is sustained through direct support from WHO and UNICEF. And the plans are that we continue with the existing modality until we find out what will happen with the new political development. I stop here.
Excellent. Thank you very much for all the great effort that you have been contributing to personally as well, Dr. Safi, in the design of this modality of work in the health system. Over 20 years, Afghanistan has really achieved a lot in order to address the challenge that you have enlisted, especially with regard to some of the key public health indicators, maternal mortality ratio, under 5 mortality, and others. And I like very much your reference to the joint work between the government and the partners then to work together towards devising an approach for ensuring the delivery of needed health services, whether it is related at the first level or at the hospital level. So the PPHS and the EPHS have been really key players in ensuring the development and the continuity of health services even under difficult times. So we wish really all the best to Afghanistan, and that the achievements that were made over 2 decades of time to continue and to even to progress further in its future. Thank you very much for being with us. Now let me move now to the country where I work and live. I'm very privileged to introduce Dr. Ahmed Subki, who has been again one of the key players in the current reforms that are ongoing in Egypt, in particular the implementation of the recently endorsed universal health insurance law. So Dr. Subki, if you allow, can you please share with us some of the key reforms that Egypt has undertaken, in particular in relation to the hospital sector, and what are the key directions of these reforms? Thank you very much. Over to you.
Thank you, Dr. Awad, and I'm very glad to see you even virtually. And before I start, let me express my gratitude and my appreciation to the International Hospital Federation and also our colleagues from WHO EMRO region, and special greetings to Dr. Eric, the former CEO of the International Hospital Federation. He is here in the hall, and also special greetings to Mr. Ronald, acting now as the CEO of the International Hospital Federation. And it's a great opportunity for me, and thank you for having me in this very prestigious panel to tell you about the Egyptian mega project for universal health insurance, and also to share the knowledge and insights regarding healthcare reform. But I think actually to respond to your question in 5 minutes is like squeezing an elephant in a small box. So I will do my best, and I will try to do this.
Thank you very much, Ahmed. We know that a lot has been happening in Egypt. So please, if you can highlight the major reforms, yes, and how they are impacting the hospital sector in particular.
Yes,
thank you very much.
Thank you. So before I will start, I will start by the fact that Egypt is the first country in MENA region to have a health insurance system. And this was, I think, 60 years ago. But over years, in that time, Egypt healthcare system was very well. And but over years, and because of the huge population growth in Egypt with the limited resources for healthcare system in Egypt, the system started to deteriorate, unfortunately, and the patients were suffering from a lot of problems regarding the poor quality of system. And let me summarize the main reasons and the main problems behind our decision to reform. So I think governance failure in the old system, and also financial failure, and also healthcare workforce dissatisfaction, and hepatitis C, because you know that in the past, let me say that in past, Egypt was the first country all over the world suffering from virus C, having the largest number of confirmed cases of virus C. Also, we were suffering from weakness of primary healthcare and unorganized private sector. Also, a lot of problem regarding the infrastructure and lack of healthcare information system in Egypt. So we realized that we need that change. We need to take the decision for total reform of our healthcare system, and by guidance of WHO, we adopt a serious agenda for universal health insurance as a tool of Egypt to achieve universal health coverage. So let me say that in 2014, we have the great commitment from His Excellency, the President Abdel Fattah al-Sisi, to put healthcare in the top of agenda. So we started to refresh our economic studies and actuarial studies for the new healthcare insurance system, and also to put the framework, the legal framework for the new system. And also in 2018, we started to make or to create establishment of five authorities, independent authorities, to reform or to redesign the governance healthcare model in Egypt. The first one is the General Authority of Healthcare, and General Authority of Healthcare is headed by me. I'm the chairman of this authority, and this authority is responsible for providing healthcare service and also acquisition of all public sector hospitals and primary healthcare units. And you can imagine that we have in Egypt more than 600 hospitals and also more than 5,300 primary healthcare units. All of these facilities were under the acquisition of the General Authority of Healthcare, and will be operated by more than 1 million personnel of healthcare workforce. We also issued the new law of universal health insurance in 2018, and also the bylaw. And then in 2019, we started the real implementation of system in Port Said, and Port Said is one of Egyptian governorates, and we started the implementation in this governorate successfully. So as we speak now, let me in a nutshell give you some figures regarding the new system. We have now more than 6 million of our population covered by the new universal health insurance system in 6 governorates out of 27 governorates. Also, we have now our own system, or our own healthcare electronic system, and we have now more than 5 electronic medical record for these covered people. And also we succeeded to provide more than 7 million services between surgical interventions and medication and diagnostic services with quality level, premium quality level, and with satisfaction rate succeeded to 90% of satisfaction regarding the latest surveys. So we have an ambition plan for the governance model to redesign the model, to separate the providing of service from the financial activity of the service, and also for separate the regulation and quality oversight the healthcare system. And also we succeeded to create some financial resources to support the financial sustainability of the system. And also we succeeded to eliminate hepatitis C as one of our catastrophic problem in our system. And now we have new system, and we have an ambitious plan to extend all of these activities in all governorates to cover more than 1 million people in less than 10 years. And we have the political commitment to do that. Thank you.
Yes. Yes, thank you. Thank you very much. I'm sorry. Thank you very much, Dr. Subki, for this great illustration. As you mentioned, the story to tell about the recent experience of Egypt, especially following the lately endorsed universal health insurance law, is really worth being devoted, to have a full session devoted for it, to illustrate it. And hopefully next year in 2022, when we hold the Congress in Dubai, we will have maybe a full session for that experience, and more lessons could be shared from there. But I would like to pick from what you have said, that a reform was needed, which means that it was at a point that something should happen in the health system in Egypt. I mean, Egypt is not a small country. It is one of the leading countries in the region, and many countries would follow the steps that Egypt would undertake in many areas, including in the health sector reform. So a reform was needed, and I think Egypt opted for a radical sort of reform, in a sense that it decided through its legislation to look at the roles and responsibilities and to separate the function. So this reminds me of the previous intervention from Saudi Arabia, where again a separation of function was at the heart of the national transformation program, but also the focus on the governance side, because if governance is done properly, then other things can follow. So to look at the legislation, the law, but also to look at the roles and responsibilities of the different stakeholders. And also at the same time, the country has focused on some of the quick wins, like hepatitis C, and this successful experience was something to capture and to get more political support and more societal support, public support to that reform agenda. So again, looking forward to learning more in the coming Congress. But now let me move to our last panelist, last but not least, my very dear colleague, Dr. Kosum As-Salmi. Dr. Kosum is the Director General of the Royal Hospital in Oman, and he has been leading really many of the reforms in the hospital that he's leading, but also as part of the overall health system transformation in the Sultanate of Oman. So, Dr. Kosum, if you could share with us some of the reflections on the reforms that are ongoing in the context of the Sultanate of Oman. Thank you.
Thank you, Dr. Awad, and thank you, WHO EMRO, for the opportunity. Health reform in Oman has started many years ago in the 1990s. And the reasons, because of two reasons: change in demand or change in supply. Change in demand because of demographic changes. Oman's age distribution used to be more pyramid-shaped. With years, life expectancy has improved, and it's more of restrictive belly-shaped distribution now. The other reason is change in disease patterns. It used to be more of communicable disease that is affecting citizens or residents in Oman. But over the years, this has changed, and now more of non-communicable diseases. So this is another change in demand that has forced and has mandated the government to reform healthcare. The third reason in demand is changes in the clientele expectations. So our customers now, our clientele, are more aware, more knowledgeable, and have higher expectations. And as healthcare providers, we need to work and strive to reach to their expectations. In terms of supplies, there are two reasons. The first one, change in technology. Technology has advanced remarkably, and now more and more advancement is there and available for our patients to receive care. So whether it is in medications or in equipment and other technologies, IT and so on. So this has mandated also a change in our system or transformation in the healthcare. The last one, which is one of the most important one, is the economic challenges. So the economy has been fluctuating over the years, and healthcare demands a lot of support, financial support, to ensure its sustainability. And this has forced the government, mandated the government to really look into that and keep it in mind when we look into healthcare reforms. Since it started in the 1990s, the healthcare reforms, the first thing was actually focusing on primary care. And Oman has been recognized as one of the best examples in having an established primary care services. It's not limited only to providing clinic or sick patient services. It's also there to promote for health and provide preventive care. This was complemented by establishing secondary and tertiary care services, which are in the hospitals and polyclinics, but also to ensure best utilizations of those secondary and tertiary care services. Oman has created an excellent referral system that was very strictly enforced to ensure that better utilization of services and minimize waste. At the same time, in the 1990s, a national health policy was created. And this health policy focused on three things. First is governance and ensuring leadership effectiveness in management of resources and providing the necessary health services. The second item is decentralization of services. We have started this in the 1990s, and we have hospital autonomy started in those years and has been there since then, and it has been really working very well for the country. The third one is actually we have introduced sustainable interventions to ensure that we have good inflow of local healthcare workers, trained, qualified to manage or to give care to our patients. We've been always struggling with ensuring that we have available healthcare workers available for us. But in the 1990s, we have introduced significant interventions to train and educate those healthcare workers. In the 2010 and 2011, Oman has worked in creating Oman Health Vision, which we called it Oman Health Vision 2050 at that time. Later on, it has changed to be Oman Health Vision 2040 to be aligned with the other government health sectors. To create that health vision, all stakeholders were included and participated in creating this document. And that includes the governments, different sectors within the government, the privates, the community, and NGOs, and so on. And this healthcare vision has actually included all the 6 elements or pillars that you have mentioned, Dr. Awad. And we have now a document that we have been translating this into implementation since then, and we've been working on it. It has got modified a bit to be aligned with the other governmental vision 2040, but it is the document that we are using now. I will stop now and thank you for the opportunity.
Again, thank you very much, Dr. Kosum. That was, again, an amazing experience. And I like the way that you have dissected the problem and the promoters for the reform between supply and demand factor, both coming together to emphasize the need for a reform and a transformation. And I have to admit, I have always been impressed by the long-term vision that the Sultanate of Oman has been putting for itself in all sectors, including the health sector. So I had the honor to be part of the early on thinking around the health system vision 2050, and then, as Dr. Kosum mentioned, being aligned with the 2040 national development agenda. And also Oman has been, while it has been very much known for the primary healthcare system and the primary healthcare reform, yet it did not neglect the hospital sector at secondary level and at tertiary level. And a lot has been done in terms of decentralization, as it was mentioned, and in relation to granting autonomy to ensure accountability in the delivery of the health system. So this has been really a great spectrum of ideas, of experiences being shared between 6 of the countries of the region. Some are high income, others are middle income, and one is low income, even a country that is being hit by several types of emergencies and currently facing some unfortunate challenges that is somehow compromising some of the successes that have been gained over time. We hope that things will be moving in the right direction, moving ahead. So now, if you allow me, I would like to ask another question to all our panelists, and we will try to be briefer this time. And I'll give 3 minutes for each of the great panelists, so that we can have also a few minutes at the end if there are additional questions coming from the floor. And my second question, colleagues, if you could kindly now think about the reforms that have been implemented, and if you can share with us one main challenge that has impeded the implementation of the reform. So what is one of the key challenges that you have observed, or the country had gone through? And the other thing, now coming with the reality of today, the big elephant in the room, COVID. So now we are thinking about how to build resilient health systems that would, while it allows us to advance universal health coverage, but can also ensure health security. So what is a lesson or a message from that reform that one has to emphasize or to stress on in the coming period to ensure that resilient attribute of the health system is also being catered for along with the other goals of the health system? So please, if you can share one challenge and one lesson in that regard. And let us go back to Morocco and to Dr. Belmadani, please. Thank you.
Thank you, Dr. Awad. So for the challenge, so the challenge we are faced in Morocco, as I said, is human resources. So human resources is the big challenge that we faced in Morocco to make our reform, our strategy, because now we have a lack of human resources, and some doctors, and they go to the other countries, especially in France, to practice in France. We have 30% maybe our human resources who leave the country, and they go to other countries to practice in Europe, because the income and it's higher than in Morocco. But now we are facing this challenge by making a new statutes of healthcare function. So the function of healthcare human resources is now separated to the other functions. So we are now making some compensation based on performance-based compensation. So the salary of the human resources will be attached to their performance in the hospital. But and we are working on that. It's a very high project, and it's the challenge, the most challenge of our system, because for infrastructures, for financing system, we can find the resources. Now we are working to finance infrastructures with the funds, some funds in Morocco, some funds some funds which can finance with the government the system of health, but the lack of the insufficiency of human resources, it's the big challenge. And to face that, we have, as I said, we have we had opened the practice of medicine to foreign doctors to come to Morocco if they want to come to Morocco to practice in Morocco, because in all countries they have foreign doctors, so there is no reasons that for now opening the country for other doctors, and we are now in this ready to open our country to other doctors.
Merci. Thank you very much, Dr. Belmadani, for sharing these. So what I could capture from your intervention, the key challenge was the limited health workforce challenge, and the lesson, if I could formulate that in terms of building resilient health system, is to invest in infrastructure. And I think this is key. This is what we have been qualifying as one of the elements of a step zero of rebuilding a health system.
Yes.
To invest in infrastructure that has been identified something very important to build a resilient health system for the future.
In primary healthcare, investing in primary healthcare and
invest in
yes.
primary healthcare. Thank you very much for that. So let me now go to Saudi Arabia and Dr. Hussein with all the great health transformation program. So could you please share with us a key challenge in the implementation of the program that has been experienced in the Kingdom of Saudi Arabia, and what lesson has been distilled to build a resilient health system for the future? Dr. Hussein.
Right. Dr. Ahmed, thank you so much. I would take the privilege to add, to give two challenges rather than one, with your permission. So
sure.
the one of the challenges which actually we learned is that the healthcare sector has always been a laggard in terms of adoption of technology. So it was always shy of adopting new technology, whether it's a unified HI system or one electronic medical record, and you name it, and all those top-up healthcare solutions, technology solutions. So I think if we go and redo the reforms, or we have to do the reforms once again, I think the use of technology would be the first one, that we have a unified technology system across the system, where we can have access to the data, a very structured access to data, and we can take decisions much faster based on those data drivers. So that is one thing which we learned. Second thing is a cultural challenge. It's a major paradigm shift we're talking about. From a treatment to prevention, from provider-centric to a patient-centric healthcare, from episodic approach, a curative approach to lifetime care or preventative care, hospital-based to no brick and mortar outside the walls of the hospital. So it's a major cultural shift, a paradigm shift as well. I think culture is something which actually slows down sometimes the speed of the transformation, because it always takes time. Not only at the patient level, but of course when we are segregating the responsibilities, we are defining new stakeholders or segregating the stakeholders. That actually also takes a lot of time, for the stakeholders to get used to their new responsibilities and start delivering on their new expectations. So these are the two major sets of challenges which we would consider, in the second wave of transformation. Now, coming back to lessons learned, and especially in the backdrop of the COVID, I think now second wave of COVID is a very good evidence that our system is much more resilient as compared to the wave one. The business recovery or business as usual, going back to the pre-COVID levels, is much faster than the wave one. So our system has learned itself. Staff is much more prepared. Workforce is much more prepared, and introduction of centrally managed disaster control, technology. For example, the command and control centers, and training the staff to use those command and control centers fully integrated from the floor all the way up to the decision makers. I think these few measures have made us now more resilient, that we can manage third wave. God forbid if there is a third wave, or God forbid if there is another new episode of a pandemic. I think system is much more resilient. We know what to drill, what is the drill that we need to do in terms of managing any of the new pandemics in case they happen.
Thank you very much, Dr. Hussein. The two challenges are really very telling, and they are relevant to many countries within the region, but also globally. And I think the idea of how the system was resistant to adapting technologies is something that is very important to observe, and how during the pandemic, while many things were very difficult to implement, how during the pandemic we have observed that countries starting adopting technology, starting adopting innovations that took years for many to advocate for and to try to train on. But in the pandemic, surprisingly, people became more agile and more able to adapt these new technologies. And thank you for the lesson to build a resilient health system, in particular with regard to the central management of and being prepared, as you mentioned, and the command and control center that has been key and will be key to ensure better resilience and to be protected in the future. Let me now move to Professor Alawi and the experience of UAE. So one of the a challenge, and then what a lesson learned, if you allow, from the implementation of the great reforms that you referred to.
Sure, Doctor. I think perhaps one grand challenge really has to do with the mindset towards change and reform. I think health systems will need to figure out how to move from the natural human tendency of being comfortable with the status quo to a mindset among healthcare providers and health policymakers that reform and change and evolution is actually not only is inevitable, but it's actually part and parcel of a learning health system. And if we make that shift, then I think we can address a lot of these challenges that health system are facing today. And part of that, making that shift in mindset is actually is information and data. So we talked a lot about electronic health records or health information exchange and making use of that data and synthesizing it and then articulating it in a way that is relevant to the receiving stakeholder and socializing it in a way that can then help with that mindset shift that actually change is a good thing. Sometimes when people talk about reform, there is a perception that you're reforming something that is not working, and that's not necessarily the case. I think like any other system, you do the best you can until you know better, and then when you know better, you do better. So reform doesn't necessarily mean that what happened before the reform was bad or good. It's just a natural characteristic of a learning health system. So that's in terms of a challenge. In terms of lessons learned from the pandemic, I think it was very clear, maybe with some contextual differences from country to country, but it was very clear that the most successful countries in terms of fighting the pandemic were countries that really practiced not only a whole government approach to fighting the pandemic, but actually a whole community approach to fighting the pandemic. And if we are to reform health systems today and face challenges that are pandemics that were there before COVID-19, the pandemic of chronic diseases, the pandemic of obesity or cardiometabolic risk in our communities, then you really need a whole community approach. And healthcare is not just the business of hospitals or healthcare providers. Healthcare is the business of every individual in the community. And that's the only way we could make a dent in some of these challenges that we're facing today. So if you're going to fight obesity, for example, in children, you're not going to do that in hospitals. You may not even do most of that in clinics. You'll have to do that in schools. And teachers will probably be more of frontliners in the fight against obesity than doctors. So unless we think of health as the business of everyone, and learn, and that's how we fought COVID-19. When fighting the pandemic was the business of everyone. It was an individual responsibility, it was a community responsibility, it was a government responsibility, and a private sector responsibility. It was everyone's responsibility. And for us to reform our health systems and advance health in our communities, I think we need to think of health as the business of everyone.
Excellent. Thank you very much, Dr. Alawi. You started by emphasizing as a challenge the question of the mindset and how to accept that that reform is constant. I think sometimes we say the only constant thing is change. So we have to embrace that and to look at it from that angle. And we always say also health systems are organic. They are like a living organism. They keep changing, and we have to keep up with that. And you concluded by giving a practical example how that change of mindset could be done with the different examples that you illustrated about whole of government, whole of society approaches for any public health problem. I think a lot to be learned from COVID, and we have been learning this lesson really the hard way. So if we don't come out more stronger and understand the lesson from it, I don't think that at any point in time we'll be able to learn how to do our business, our work in supporting the health and well-being of our people. So thank you again for this intervention. Now let me move to Afghanistan and Dr. Safi. So please, if you could share with us a key challenge that the country has been faced with while implementing the reforms, and what lesson from the current pandemic to build a resilient health system moving forward.
Thanks a lot. I think it's very difficult to pick up one challenge from a system which is facing hundreds of challenges. So this is first challenging. But what I can say that possibly contracting out of health services, this was a new approach for service provision. So managing those contracts effectively, that was a challenge because we didn't have enough capacity and experience to manage those contracts. If we were able to manage those contracts in an effective way, we could have more attractive achievements today. And another point, which was minimum domestic resource allocation for health. It was always below 4%. So these two were the major challenge that we face. Lesson learned, and I think how to have resilient health system, irrespective of COVID, I would say. I think political will and ownership. Political will, which is confirmed and supported by domestic resource allocation. That is the key. And then looking to the last few months' changes, I think diversity of resources, using different health financing mechanisms to finance the health sector, health system, including increased domestic resource allocation, establishing a prepayment mechanism, and also using innovative approach like funding from zakat, allocation of fund from zakat to health, to have different sources of funding. So that will help us to have a more resilient system which could survive during such shocks. Overly relying on donor funding, which we did over the last 20 years, I think that put health system at a higher risk of losing the gain overnight. I stop here. Over.
Thank you very much. And I feel if you allow me, I feel the pain in what you are saying, the way that you are describing it. So all our hearts and minds and wishes are with you, Dr. Safi, and the country moving forward. But just distilling from what you mentioned as a challenge, embarking on an innovative way of doing business, contracting out. The country has never been used for this and had to implement it. And Afghanistan was learning while doing it, but was also providing lessons for other countries, which it became like the model example of how to run service provision under acute and chronic emergencies. And as a lesson, I could take from what you have mentioned, the importance of the political will. I mean, this is a buzzword we have been using a lot. I think a key challenge maybe to think all together about is how to create that political will so that it exists and it is sustained. And your last point about diversifying the source of funding is really very, very important as well. So let me go back to my dear friend, Dr. Ahmed Subki, and to share with us from all the plethora of experiences of Egypt that he outlined to us, what is one of the key challenges that the country has faced with, and what a lesson from the response to the pandemic towards a more resilient health system.
So thank you, Dr. Awad, again, and I think, as you said, the only constant and the only constant is the change, and the only constant in the change process is the challenges. So, according to the Egyptian experience, we faced a lot of challenges regarding the reform, and we are anticipating to face more and more challenges in the future, and we are ready to deal with these challenges. But let me move to the most important or most serious challenges we faced in our journey to implement universal health insurance, which was the governance model. And you know that the governance is the first pillar in the pillars of healthcare system according to WHO guidance. So the new governance model in Egypt, which is composed of, as I said, five authorities, independent authorities: General Authority of Healthcare, which is, as I said, responsible for healthcare provision, and also General Authority of Universal Health Insurance, which is headed now by the Minister of Finance, and it's responsible for the financing of system and purchasing of healthcare services from the public sector represented in General Authority of Healthcare, and also the private sector. Also, a very important organization, which is the General Organization or the General Authority of Accreditation and Healthcare Regulation, which is directly reporting to His Excellency the President, which is responsible for setting the quality standards and patient safety standards, and also give the accreditation to all facilities want to join the system, and also monitor the system. And also we have now in Egypt Drug Authority and Strategic Purchasing Authority. So all of these functions were done by the Minister of Health, and now we are in the transformational phase to the new healthcare system. And the role of Ministry of Health will sustain to give or to provide the preventive and ambulance care for all Egyptians, and also oversight the whole system and putting the KPIs and policies for the successful system of universal health insurance. So it is the main concern and the main challenge is to integrate the functions of all of these authorities, and also move towards extension of the umbrella of universal health insurance in Egypt. Besides that, the elimination of virus C, and as you said, it was very critical for Egypt, and it's paved the road to universal health insurance implementation. And you know that Egypt succeeded to screen more than 70 million citizens from virus C and also the non-communicable disease. And now we have the verification of WHO to be eliminated from virus C, and it is a huge campaign, I think, in the medical history. So it's a great success for Egypt. Also the financial resources and how we created more and more financial resources for financial sustainability of our system, beside the premium collection, beside the co-payment collection, beside creation of, and thanks to Dr. Ahmed Khalifa for assisting us for this payment system, and Dr. Gasser also assist us, and also create more than 13 additional resources for financial sustainability, also compliance to quality standards, and thanks to the law that obligate all facilities to have the accreditation before joining the system. And also digital transformation was one of our main challenges, and the training and linking of the incentives of healthcare workforce to the commitment of system was one of the lessons learned from our journey. So in few words, I can see that, or I can tell you that the lessons learned from our experience and the implementation of universal health insurance was that there is no reform or no change or no mega change without political leadership commitment. So it's a mandate. And the second is the communication is key for implementation. Also, training and awareness and engagement of healthcare workforce and well-being of healthcare workforce, and commitment of these personnel to national training program is a key challenge and is a bridge toward a successful change. Also, data and KPIs is critical for improvement and for continuous optimization of system. Thank you so much.
So you want to make sure that we understand that Egypt holds a lot of lessons for all of us. So we are really counting on you and on the Egyptian team for next year to share more information and more lessons from the experience of the country. I just want to pick on the governance. Thank you very much, Dr. Ahmed. On the governance, the importance of the governance, but also on a word that you mentioned, Dr. Subki, that you used the word integration. So we have been talking about separating function. However, that separation, you referred to it as integration. I think what you meant is to coordinate across the three entities that are being created as part of the law. So it's not about reunifying the functions in one entity, but to ensure that there is concordance, there is harmonization, there is alignment, there is clarity about who's doing what in that regard to ensure the moving forward. And I would like really to invite all colleagues who are with us and who are listening to us to check a recent paper that came out 2 weeks back on the governance of the universal health insurance law. Dr. Subki referred to Dr. Gasser and Dr. Khalifa, who are in the hall, and they are among the key authors of the paper. So please do have a look at it. It came out in International Health Policy and Management, I believe, and that summarizes some of the experiences of Egypt. But let me now go to Dr. Kosum. So Dr. Kosum is the hospital manager amongst us. So we are more or less policymakers, coordinate regulators, advocates, but he's the one who's doing it day to day. And by managing one of the key hospitals in the Sultanate of Oman. So Dr. Kosum, can you please share with us briefly a key challenge that the health sector reform has been faced with in Oman, and what lesson for building or rebuilding a health system that is more resilient for the future?
Thank you, Dr. Awad. So agreeing on a transformational health system plan is one level of a challenge. But translating that plan into an action is a much different challenge. Having all the stakeholders involved with all their competing interests, it really gives a great challenge to anyone who is interested to implement a plan. And this is what happens. With Oman Health Vision 2050, all stakeholders were consulted, all agreed on the plan. But when it comes to implementation, it was very difficult, and it continues to be difficult. And here where leadership skills has to play in and navigate through all those challenges and ensure the implementation goes on. So that is for a challenge. For lessons learned from the operation side, we think we need definitely a health system that is agile. And this is what we learned from COVID. A fixed, rigid healthcare system is not gonna work anymore nowadays. We need a health system that is agile, that can recognize early the needs of the community and the threats to the community, and works accordingly, mobilize resources, redeploy human resources, and so on. Quick decisions to make sure that we are fulfilling our needs. So an agility in our healthcare system is a mandate nowadays. Thank you.
Thank you very much, Dr. Kosum. I very much like what you mentioned. Devising a plan is something, and implementing it is something else. And agility is an attribute that we have been we have been talking about that in the past, but now it has become really at the heart of any health sector reform, any health system strengthening agenda. The key things to address and to invest further in is what does it mean, and how to make it operational, and how to ensure that the health system is resilient. What are the attributes that need to be invested in, and to ensure that this is happening. I mean, this has been really an amazing round of introduction and round of interventions from great experts, great leaders from different countries of our region. I hope that you enjoyed, colleagues, the discussion that we have gone through. We are almost close to the 90 minutes of the session, but I would not like to close before seeing if there are any questions that are coming from the room or from any of the colleagues who are connected online. If there's anything that I would request the facilitators, if they can share those with us so that our great panelists can react to them. If not, yes, I see the hand of Dr. Hamid Rabaghi. I see his back head. So I think that's him.
Thank you.
I see also the back of the head of Ahmed Khalifa, so that's one.
So many thanks to all of the distinguished presenters, and thank you, Dr. Awad. One thing I want to highlight is the importance of documentation of these exercises, these successes, failure. So I think one of the things that we are suffering and lacking in the region is not enough evidence generation. Really, and I would like to emphasize in this as part of the main message that really we need to document these great, and success stories. Thank you.
Thank you very much, Hamid, for this. I think this is key, and maybe it's our duty, even as health advocates, as practitioners, as even policymakers, and people who are very keen and interested in health, to document these for the sake of our own populations, but also for the sake of learning to share it with other countries. And maybe this is something that we need to work on over the year, so that in 2022 we can really present to the Congress and to the world more experiences from our region, documented in the proper way. So if there are no further interventions or hands raised from the room or from outside, so let me thank all great panelists for their availability and for their generosity in sharing with us these great experiences, and looking forward to continue our collaboration, our partnership in supporting health system strengthening towards universal health coverage and health security in the region and globally. Thank you very much.
But before, if you allow me to send Egypt's congratulations to Dr. Eric and to Mr. Ronald for the great success of the Congress this year. And our greetings to our friends and our brothers in United Arab Emirates to have a great success also the next year. Thank you.
Thank you very much, Ahmad. I mean, we have been working very closely with the International Hospital Federation. I consider both Eric and Ronald as part of us, and we are part of them, and looking forward to our continued collaboration. Thank you very much.
Thank you.